Okay.
If you could, are you in front of a laptop?
Yes.
Maybe adjust your laptop like this so there's a little less headroom.
Oh, okay.
There we go.
Oh, okay.
Okay. And so, how do you pronounce your last name, Avery?
Chesser. You don't necessarily have to say the hyphen part, but they know me as like Avery Chesser.
Okay. Okay.
And how do I?
How long did you?
Oh, go ahead.
Just some background information before I press the record button. How long did you work for Clinical Labs?
For over a year, about a year and a half.
Okay. And do you live in the Hilo area?
Yes, I do. I live in Mountain View.
Okay. And the last time you went into Yukio was when?
It would have been the probably mid-August or so. Yeah.
So the outbreak started at the end of August.
Yeah, that's when it got really bad.
Right. Okay. So yes, most of my questions will focus on Yukio, and we can I can ask you a couple of other questions as well. This is not live, so we kind of cut and paste. And when you answer the questions, Avery, try to look at the camera on your laptop. So try not to look at yourself and try not to look at me. I know that's kind of hard, but
Oh, okay.
yeah. I mean, you can glance around in between questions.
Okay.
And again, it's not live, but it's the magic of television on Zoom.
Right. Yeah.
Okay, so I'm pressing record, Avery. So you were last in Yukio as a phlebotomist to draw blood in mid-August. This is really right before the first deaths in the outbreak. Just what was it like going in there to do your work?
Well, it looked like they had a really good screening process. They had like a hand washing station. They had a log that we would give our name and our cell phone number. So it looked like they had contact tracing in place. It was very clean when we walked in, but it seems like we thought, because we lived on an island, that it was never going to get as bad from the mainland as it was in the mainland. So it was like over a period of time, since about April, it started to get a little bit more laxed. I mean, there was time when they didn't have people manning the desk and so forth. So it was almost like we thought we were immune to COVID actually hitting us. And so the things that I would notice when I would go to draw blood, which as a Clinical Labs employee, we would do it 5 days a week. And when we go to draw blood, they would have these rooms that were in quarantine. And when you're in quarantine, you typically have a disposable gown, you have a mask, you have a face shield, and depending upon the type of quarantine that it is, you would have a certain kind of prescribed PPE. Well, we didn't have the PPE, so instead of the disposable gowns, they would give us patient gowns to wear into the room. So it really afforded really no protection. And those gowns would be re-washed and transported back to the laundry room and so on and so forth. And as a contract employee, going in there, they never inspected my equipment. And unfortunately, some of the practices at the lab, there wasn't a lot of sanitation in the drawing trays that we had. And so we would carry those drawing trays from patient room to patient room. So in other words, people that did not have COVID, they could be using a drawing tray in patient rooms that did have COVID. And being that our PPE, we were expected to...
Avery, I'm going to stop you.
Yeah.
Can you say that again? Because your signal broke up a little bit. So one of the issues that the report has been talking about was that there was no, there was mixing of staff. So were you going from quarantine room to non-quarantine room to?
Yes.
Is that what your situation is? Can you explain that again?
Yes. We attempted to first draw the non-quarantine rooms first. That's what we were kind of told to do. But at a certain point, especially in the beginning, it was hard to tell which room was quarantine and which one was not, because you would see people going in without any PPE going in and out, and it would be a situation where when you would go to draw them, they'd say, oh, well, that person has not really tested positive for COVID. They're just on a 14-day wait period because they just came from the mainland. So you don't really need PPE to go in. And they would say, don't worry about it. And so, you know, in the beginning, I was like saying, okay, that's a nurse telling me that, or that's an employee of Yukio telling me that. So I guess it's okay for me to just go in and draw blood with my gloves on. And that's where, when I started putting two and two together and they started getting the first cases, I go, wow, this is a perfect storm to have an outbreak of COVID. And so
So you would go into those rooms, Avery, with just gloves and no mask and no disposable mask.
Right, and that was in the beginning. That was like towards, you know, April.
Right?
Oh, yeah, I can hear you.
Can you describe that again? You into the rooms with no mask and
Without PPE, because when I would ask for it, they did not have it. And so they would, basically the nurses would say, well, that person is only here from the mainland, so they're on a 14-day mandatory, but I'm pretty sure they don't have it, you know, because they don't have any symptoms or anything. And so there's this culture there of we have to preserve the PPE, and so only use it when you either know they have COVID or they have presenting respiratory symptoms, and then we would use it. And then there were times like when we didn't have like the right size gloves and stuff, so we'd either have extra small or extra large. And so we didn't have the right equipment is basically what occurred. And
did you read the VA reports and the Hilo report in regards to its inspection most recently of Yukio? And did you read those and did you see things that were matching with that report?
You know, I have not had a chance to read that yet, but I'm very interested in looking at that, because I could see that there was definitely a culture of very laid-back culture, like, because it didn't hit us in the beginning like it did the mainland, that people were saying, oh, it's not going to hit here, we're just going through these motions, and not really following through. Even though I logged my name and my cell phone number every day, and I drew most of the patients in that hospital, I have yet to receive even one phone call saying that my patient tested positive for COVID. So obviously they were not following contact tracing protocols, because I left my personal phone number there.
And you must have done, what, dozens of blood draws in Yukio? I mean, you must do a lot of that.
Well, there would be approximately 7 draws per day. And so I personally probably did about 40 or 50 over that period of time. And one of the things that would happen is there was absolutely no procedures communicated with clinical labs and Yukio, as far as once we got past the front door, like simple things like, where do we put our tray when we're going to a quarantine room? There was no place to put the tray, so we would have to bring that tray into the patient's room. And then there was not any kind of mandatory sanitation to take place. So in other words, you know, there was no inspection of that, which to me that would be the principal thing. And, you know, I've been in phlebotomy for about 6 years. I have several national certifications. I have a license in California. And I could see that that was just going to be a perfect storm for a spread of COVID. Just seeing and witnessing the procedures that were taking place.
from hospital to Yukio and to the other facility, before this pandemic on the Big Island really blew up. I mean, it had already blown up on Oahu, right?
Mm-hmm.
I know you know the stories that were happening at Oahu, but really the Big Island was doing good for so long. What was it like for you, just as a frontline worker, going to these different facilities and having close contact with people that you didn't know had COVID, but obviously they were in quarantine, or they were just in a hospital setting, or they were suspected of having COVID?
Well, it was, it seems like there was a lot of faith being put in the screening process at the front door. The fact that they checked to see if you had a temperature before you went in and all of that. But there was not a lot of focus on the process of how you have contact with the patient and how to prevent infection and how to, you know, where you set your tray and what are the steps on putting on your PPE. And then the fact that they're having us reuse PPE, so we're literally going from room to room with the same PPE. And the way that life was like prior to it is, it was very much an aloha environment. You know, they call the patient auntie, uncle, and stuff like that. And I think a little bit of that laxness is what kind of progressed the problem. It's like, you know, when I personally started to go to draw patients at Hale Anuenue, and at first they didn't have like a barrier put up between the COVID rooms. And so, you know, you would just try and, they had actually, it was like one of those yellow fence things that they use on construction sites, and then you would just kind of move it over. And it was just very unprofessional. And when I would go and draw the patients, you know, I kind of felt bad because a lot of people, I mean, literally between the different phlebotomists, they would be, you know, like, oh, I don't really want to go over there because I got kids, and we know it's risky because we know we're doing something that is probably not safe. But, you know, sometimes, you know, people would volunteer. I would always try and volunteer when I could, and I would go there. I felt bad for the patients because they felt very, I don't want to say neglected, I would say more alone, because people would treat them like they don't want to be around them. You know, there was no more the aloha and stuff like that. It was more, you know, I don't want to draw that patient. I don't want to have contact, you know. So but when I went into Hale Anuenue, I again found a place that really did not have standards in place to protect the patients and whoever's going in there. And, you know, the procedures and stuff were very lax. To me, when you're in a global pandemic, you know, there should be a minimum of 2 people to go draw blood. And the other person is kind of like an observer to make sure that the procedures and practices are being followed. In fact, in the safety videos that we watch from Hilo Medical Center and stuff, that is kind of the procedures. But the procedures were not followed because there was not adequate PPE. And so we reused gowns, we reused face masks. One N95 mask was supposed to last for 3 days. Well, I used that N95 mask for ER. I used that N95 for the entire hospital, ICU, where there were COVID patients dying. So the same mask is being used. The same face shield, which is a single-use face shield, that was expected to last the duration of our employment. They would never, ever replace that. And it was a really cheap face shield. It was kind of like, almost like a toy face shield. It was just this really flimsy plastic, and that was our protection. And so I, you know, basically, if we went and complained about it, they would just say, well, there's no more equipment. There's nothing that I can do. I got this stuff on back order or whatever, you know. So every time you'd go in there, you would think, well, is this the time I'm going to get COVID? You know, you know, did that patient kind of coughed and their cough kind of landed on me? Did I get COVID from that? You know, that was kind of like the feeling. But I also saw a lack of professionals there, a lack of people who are experts to create an enclosed environment to prevent the COVID spread. So, like when I went to Hale Anuenue, they had
a lack of professionals where? At the hospital or at Hale Anuenue?
Well, actually more like Hale Anuenue and at the Veterans Home. You know, there was a lack of people to like oversee that, you know, this is what we have to do to prevent the COVID. So I'll give you an example. They had a fan blowing in the middle of the hallway at Hale Anuenue, which that's not something that is really should happen, because it basically, the circulation of air actually helps circulate the virus. So typically you would want to have a negative pressure room, which actually pulls the virus out. So you don't ever want air to be like circulating. You want it to be pulled out of that room. And so I would see little things like that, and I'm like, you know, going, gosh, I don't feel very safe here. And then I would also see employees, because they didn't want to put on the PPE, and they think they're doing a favor for Auntie, bringing her coffee real quick or something, they would just go in without the PPE. It's almost like they thought either COVID wasn't real, or they couldn't get it or catch it. And I saw that actually at Yukio and at Hale Anuenue. You know, so it was a very lax environment. And so I am not surprised.
Can you say the last statement again? It broke up a little bit. Can you say the last part that?
Yes. So it was a very. Yes. People were going in and out of the room, maybe to do something quick. You know, like, oh, Auntie needs help to go to the restroom, or needs help with wants a cup of coffee or something like quick, right? So they would just go in, because there's a shortage of PPE. They wouldn't gown up and they wouldn't get the protective things, but they would go in almost thinking like they were immune. I remember the first day that I walked there, they had this like plastic covering, like where you go into Hale Anuenue, and I saw this guy just walk in without PPE, and I said, doesn't he have to have PPE on at that point, you know, when he crosses that boundary? And they said, oh yeah, well, they're just kind of getting set up. But it was like, it wasn't a concern. And to me, that would be terrifying. I mean, even me with my PPE, even though it was like, you know, secondhand PPE, and it was, you know, I didn't feel 100% protected with it, I would never go in a place without PPE. But I saw that happen a lot.
Yeah. And
so
Anuenue had cases of its own, right?
Oh, yes. Yes, there's been a lot of cases. And also what I personally saw is some cases from the Veterans Home got moved to Hale Anuenue. You know, so I would be drawing patients in Yukio, and then all of a sudden I'd go, oh, that person was just in the Veterans Home. And so that was just really an odd thing for me.
So why did you get fired from clinical labs?
Well, because there is a policy in place that if you have either nasal congestion, headache, fever, etc., and you don't pass the screening process on going in, then you're not allowed to be in the building. Well, basically, clinical labs was taking disciplinary action against me for not reporting to work, and clinical labs themselves said for me to get a negative COVID test before I could return to work. And so I went through all of the processes and procedures, and they were still taking disciplinary action. They did not terminate me, but they were taking disciplinary action. And so I was seeing it all the time. People, when they were sick, they asked them to come to work anyhow. And the thing is when I went to see my doctor told me, because you were exposed to COVID positive patients and you are presenting with nasal congestion and your eyes are red, you need to go on quarantine. And and I was under a doctor's care and everything, and they were still taking disciplinary action. And I was very upset, because not only was I risking my life and, you know, kind of accepting this second-rate PPE, but they were taking disciplinary action for me doing something that's responsible, for me trying to prevent the spread.
So you ended up quitting because of the disciplinary action? session.
Yes, yes.
Over attendance, basically.
Over attendance, exactly.
Yeah, yeah. Okay. Avery, why are you speaking out?
I'm speaking out because I can see that people's lives, families are being affected. And I just want this to stop. I want for people to take this serious. I want the experts to be put in place. And, you know, all of this PPE that they say they're shipping in and they're providing, where is it? And also, you know, on behalf of all the healthcare workers out there, you know, Clinical Labs has a policy that if you do test positive with COVID, it's on your dime. And if you take a 14-day quarantine, you will not get paid. And so what do people with families do? And, you know, what that does is it causes people who either may contract COVID or may be symptomatic, it forces them to go to work. And they're, you know, it's just going to cause more and more spread. And for someone like myself, who I'm fairly young, but not that young, but I'm healthy, I'm probably going to survive it. But the patients that we're drawing, as we can see by the number of deaths at Yukio, well, those people, you know, don't have a good chance of surviving. So it's very important that people take this serious.
Avery, thank you so much. I really appreciate you sharing your story, and I got your photos, and I guess you're going to be looking for a new phlebotomy job somewhere?
Perhaps. I could actually be going back into teaching because I've had years of teaching as well. It's really up in the air at this point. But.
Okay. Thank you, Avery. Thank you so much. I appreciate it.
All right. Thank you.
And if I have any other questions, I'll text you.
Okay. Perfect. Have a great day.
Thank you.
Bye-bye.
Bye.